Welcome to Nursing School Explained. In this review, an example of this Q&A review for NCLEX RN by F.A. Davis. You probably know that I'm a big fan of F.A. Davis products because they work well and they reflect the latest NCLEX test plan. They give you alternate format questions and they give you the rationales for correct and incorrect answer so that you know why the correct answer is right and why the incorrect answer is wrong. So let's take a look at an example here. So we are here in the basic care and comfort chapter, and we're going to go over question 548. So it says, the nurse is inserting a urinary catheter in the client with urinary retention. During balloon inflation, the client reports pain. What is the nurse's best action? Number 1, withdraw the sterile water from the balloon and advance the catheter further. Continue inflating the balloon as this finding is expected during catheter insertion. Remove the catheter and reattempt insertion with a smaller urinary catheter, or reposition the catheter by rotating it slightly and continue to inflate the balloon. Now, just think about what a catheter looks like, where that balloon is located, because you know that during balloon inflation you have a problem because the patient says there's pain. So what's the best action? Let's look at our answers here. 548, so over here. So here our answer is number 1. The pain may be from the balloon being inflated in the urethra rather than the bladder, which is not where it belongs. Emptying the balloon and advancing the catheter will allow the catheter to enter the bladder. That sounds like a pretty good explanation to me. Then, pain during balloon inflation is abnormal. Continuing to inflate the balloon could damage the urethra because now you're blowing it up in the urethra in a small tube rather than the bladder, the big cavity that we want to get into. Number 3, the catheter should be removed if an attempt to advance the catheter fails. The size of the catheter does influence the pain experience during the balloon inflation when improperly located. And then number 4 over here, repositioning a catheter with partially inflated balloon could damage the urethra and cause more pain for the client. And then here we have a test-taking tip that says, note the words best action in the question. 3 options are similar with keeping the balloon partially inflated and the other is different. So this is what you're going to be looking at in these questions here and in the rationales. You're always going to get a test-taking tip and you're going to get the explanations for the rationales for the correct and incorrect answers. Remember, with a coupon code PETRA20, you always get 20% off plus free shipping in the US from any F.A. Davis products. So I highly recommend this book as well as this other one, Prioritization and Clinical Judgment for NCLEX RN, because this one also has clinical case studies which we will encounter on the next gen NCLEX. Thanks for watching. Good luck in your studies. You got this.